to welcome you to this event. I think we all understand the motivation for the symposium. As COVID-19 has expanded rapidly around the globe and the human toll continues to climb, we are called on to understand the dynamics of this disease and to do so in a way that can inform its control. While meteorology and environment have certainly not been the primary drivers of COVID-19 patterns to date, there is reason to expect that, like many other coronaviruses, SARS-CoV-2, the virus that causes COVID-19, might be sensitive to some degree to seasonality, to climate zones, to meteorological variability, or to other environmental factors. At this stage, we understand very little about these sensitivities. Insomuch as meteorology and environment play a role in COVID-19 transmission and impacts, it is imperative that we advance our understanding and its use in policy-relevant risk monitoring and forecasting as efficiently as possible. So from a scientific perspective, our objectives this week are to take stock of what is known, to identify opportunities, gaps, and barriers to actionable environmentally informed COVID-19 forecasts, and to inform priorities for research and communication on this issue. Now, we are doing this in an appropriately socially distanced manner, and I thank you all in advance for your patience as we work through any technical challenges that arise during the week. As you are aware, the platform for this meeting is being provided by the American Geophysical Union, and if you have any technical difficulties or other questions related to the platform, you can direct them to support@agu.org, support@agu.org at any time. And with that, I'll hand it over to my co-convener, Dr. Neville Sweijd. Neville?
So thank you, Ben. Good afternoon to all from a cool and wintry Cape Town in South Africa. As we say in this part of the world, please consider all protocols observed, especially because we are in such new territory and there are really no protocols for a meeting like this. So a few words from me. I'm Neville Sweijd. I'm the director of the Alliance for Climate and Earth System Sciences, or the ACCESS program, which is a research consortium in South Africa. We're really grateful and pleased that our early response with a set of local colleagues here in a group called the COVID Environmental Reference Group has made contact with so many people working on the same questions all over the globe. And here we are in record time with this symposium. And I'm proposing a word of the year for 2020, which is going to be the word unprecedented. We have 650 odd delegates registered to attend the meeting from about 70 countries around the world. You will have all received information about the programming and can see the detail online. The live events comprise 4 elements: the keynote talks, panel discussions, poster viewing, and the breakout groups, which will be on Wednesday and Thursday. And the live events are roughly divided into 3 thematic days. Today, we'll focus on the environmental linkages, tomorrow on how these can be used for predictions and projections, and then on Thursday, on the experience and actionable information. I hope that you'll all enjoy this event and use the time that we have together as best you can. I encourage you all to use the various channels of communication, start new collaborations across the globe during this and beyond the meeting. And a quick thanks to my co-conspirators, Ben and Joy, and the scientific committee, GeoHealth, and the fantastic team at AGU. And now over to my colleague, Joy. Thank you.
Access South Africa, Future Earth, Elsevier, publishers, and all of the members of the scientific committee. They have all been working relentlessly to bring this event together very quickly so that we can review. So on behalf of WMO, I would like to extend a huge thank you to AGU for logistically making this virtual symposium possible, to Ben and Neville, and our co-collaborators at NOAA, GEO, Access South Africa, Future Earth, Elsevier publishers, and all of the members of the scientific committee. They have all been working relentlessly to bring this event together quickly so that we can review the state of the science, identify misconceptions and key questions that need answering, and make credible information available around the world as soon as possible. So this is a very important discussion for the WMO because it will help us assess both what is known and what is not known about how environmental conditions may influence the transmission of the disease and its seasonality. Operational disease forecasting using weather information could become a powerful tool to inform control measures as it has for other diseases. But we first need to take a hard look to discern the viability of doing so and shed light on how we can contribute best to global efforts to get this disease under control. So again, thank you for participating this week, for sharing your work, and most importantly, for coming together as a multidisciplinary scientific community to learn from each other. The WMO Research Board Task Team on COVID-19 and environmental factors is also here this week learning from you, as they will be considering the outcomes and all of the studies presented in this symposium to help them make some authoritative statements on the science starting this fall and periodically as the science evolves. So I'd now like to hand over to Dr. Jürg Luterbacher, the Chief Scientist of WMO, to introduce our high-level speakers. Thank you.
Dear ladies and gentlemen, dear participants, it's a great honor for me to chair this welcome session with 4 distinguished and very honorable speakers. The first eminent and esteemed speaker addressing his welcome to the symposium is Professor Petteri Talaas, the Secretary General of the World Meteorological Organization.
Thank you, Jürg, and dear Minister, dear colleague from GEO, dear colleagues from World Health Organization, dear scientists, and dear representatives of Met Services. Thanks for organizing this very important event. I think this has been a great idea, and as we all know, COVID is driving many things at the moment, and I'm sure that it's going to be driving the world economy and human well-being for the coming months and even coming years. And there's very wide interest behind this conference that we are in at the moment, and this has been also demonstrated by several governments, and also the Met Services in various countries have been requested to investigate whether there's a connection between COVID-19 and weather conditions. I have understood that the organizers from American Geophysical Union, you have been forced to extend the amount of participants because there has been so wide interest behind this conference, which is a good sign. And as we all know, when we talk about normal influencers, there's a clear weather dependence and seasonality. And so far, I haven't seen clear indications whether there's such a thing behind this COVID-19. And I'm sure that during the coming days, we will learn more about that. And it's a question whether there's a dependence on weather, climate, UV radiation, or air quality. And we are also very interested in promoting services related to health and weather parameters. We have recorded more than 100 abstracts, and this is also showing that this is a hot topic also among the science community. And I would like to thank all of you who have submitted abstracts for your invaluable contributions in the fields of health and weather, and also related to operational services of health and weather. At WMO, we are friends of concrete action, and therefore we would be happy to see something concrete coming out of this conference. And we have several wishes for you. First of all, we would like to get the scientific summary of the COVID weather scientific understanding where we stand at the moment, and we would like to establish a WMO research board task team on COVID-19, and we would like to enhance also cooperation which is already excellent between WMO and World Health Organization. And finally, we expect that we would see scientific statements during the coming 2 years concerning this relationship between COVID-19 and various weather and atmospheric parameters. I would like to wish you all successful conference, and I would like to especially thank the organizers of this conference and also our first Vice President, Celeste Saulo from Argentina. She has played an important role to get our research board engaged in this conference. With these words, welcome on behalf of WMO, and I would like to wish you all very successful conference during the coming 3 days. Thank you.
Thank you very much, Professor Talaas, for your very insightful and important words and your permanent support. Our second distinguished and honored welcome speech is delivered by Dr. Daan Toit. He is Deputy Director General from the International Cooperation Resources of the Department of Science and Technology, who will represent the Honorable Minister Nzimande of the Republic of South Africa.
Ladies and gentlemen, distinguished guests, my name is Daan Toit, and I'm a Deputy Director General in the South African Department of Science and Innovation. Today it is my privilege to represent South Africa's Minister of Higher Education, Science and Innovation, His Excellency Dr. Nzimande, who unfortunately, due to very urgent government business, could not join us. For the South African government, and indeed for the Department of Science and Innovation, it is an enormous privilege to be associated with this critical event, which we'll consider one of the most essential science responses to the global COVID-19 pandemic. Indeed, for our department, it is a privilege to be working with such important and historic partners, such as the World Meteorological Organization, the World Health Organization, and indeed the Group on Earth Observations. There were 3 key reasons why it was important for South Africa to concertedly support this event. First of all, it will focus on a key science response to COVID-19. Secondly, it will enable deepened international cooperation in this area. And thirdly, it will bolster global solidarity. In South Africa, as indeed in many other countries and regions, science was at the heart of our response to COVID-19. But that response has to be an holistic one. It has to be a multidisciplinary one, bringing together experts and knowledge from a range of disciplines. A key consideration is to better understand the meteorological, climatological, and environmental factors which impact on COVID-19. We can thus not only but fully support an event such as this. Of course, in South Africa, investment in the environmental sciences, notably through our Alliance for Collaboration in Climate and Earth System Sciences, Access has been a strategic science priority, and we are delighted that many of our Access team contributed actively to this event. More than ever, we need international collaboration in science, and we hope that this event will enable enhanced sharing of experience and expertise and data, embracing the principles of open science and open data. We would also be delighted if this engagement could lead to intensified joint R&D collaboration and indeed joint investments by R&D funding agencies. South Africa would certainly be interested to support such an effort. But perhaps most critically, we do hope that the event will be a platform for enhanced scientific advice to various international decision and advisory bodies. Despite COVID-19, our world still has to confront several other major global challenges, such as food security, energy security, climate change, as well as inequality and poverty. So international solidarity is more important than ever to confront and defeat these. This has also been a theme for South Africa's current chairing of the African Union. We are confident that this event, by bringing together concerned parties from across the world, will serve to deepen that international partnership, friendship, and indeed solidarity. COVID-19 knows no borders, and neither should our international response and our international solidarity. On behalf of the department, I would like to congratulate in advance and thank everyone who contributed to the organization of this very important event. The Minister certainly looks forward very much to learning of the outcomes of this event, and you can count on South Africa's full support for appropriate follow-up actions. And thank you.
We would like to thank Dr. Daan Toit very much for his important and also enlightening welcome speech. The next famous and respected welcome speech is provided by Professor Gilberto Câmara, Secretariat Director of GEO, the Group on Earth Observations.
Good morning, good day, everyone. Welcome to the WMO Virtual Symposium on the climatological, environmental, and meteorological aspects related to the COVID pandemic. I am Gilberto Câmara. I am Director of the Secretariat of GEO, the Group on Earth Observations. GEO is an intergovernmental organization with more than 100 member states and more than 100 participating organizations. And our goal is to provide access globally to satellite and in-situ data about our planet. This data is promoted to be available as openly as possible in such a way that those wanting to solve environmental issues have a much better means to understand what's happening to our planet than it would be if this data would not open. In relation to the COVID-19 pandemic, GEO has held a community of practice. This community of practice on Earth observation and health has been a meeting for many years, and obviously more recently due to the COVID pandemic, it has been meeting much more frequently to understand the different aspects related to this terrible situation. Today we have the pleasure of having keynote speakers who are going to talk about the different aspects and different measurements that have been made possible about the environmental factors that affect the COVID pandemic. And this is to be very important, and of course it will be complemented by poster sections where recent works on the topic will be made. GEO remains committed to provide data, useful data, for the different challenges that face mankind in our global crisis. Of course, the COVID pandemic is the immediate issue that we all worried about, but also we have our commitment to support the Sustainable Development Goals, the Paris Agreement on climate change, the disaster risk reduction, the new urban agenda. The most importantly, the principle of openness of the data, transparency and reproducibility, that has been made so crucial in the global response to the COVID pandemic, is part of GEO's DNA. So it's enormous pleasure that we are part of the community today, meeting at the auspices of AGU to discuss this very important topic. Thank you and have a productive meeting.
We very much thank Professor Câmara for his important messages, his suggestions and the good wishes for a successful meeting. The fourth esteemed and prominent welcome speech is delivered by Dr. Soumya Swaminathan, Chief Scientist of the World Health Organization.
Good afternoon, good morning, good evening, colleagues. I'm Soumya Swaminathan. I'm the Chief Scientist at the World Health Organization, Secretary General of the WMO. Your Excellencies, gives me great pleasure to share a few thoughts with you at the opening of the e-symposium that the WMO is hosting on the climatological, meteorological, and environmental factors in the COVID-19 pandemic. And I'm very happy that WHO colleagues are working together with you and a huge number of global experts on investigating these issues. As you know, right from the beginning, from January onwards, we've been engaged with a global community of scientists, researchers, and doctors and academics in trying to understand more about this new virus. And there are so many things that we've learned about this virus, but there are many more that we still don't know. For example, what is the impact of climate, temperature, and humidity on the virus and on its transmissibility? Now, this is something which has been of great interest to people. In fact, there was a lot of hope that the coming summer months would actually result in a decline in this pandemic, at least in the Northern Hemisphere. Now, this has not stood out, and the virus seems to be able to spread as long as it has human-to-human contact. In fact, later today, we're hosting another expert consultation on transmission, on how, where, and when this virus transmits most easily. There are, of course, a lot of questions also about the individual, the biological factors on why some people seem to get a completely asymptomatic infection and others go on to develop really serious symptoms and sometimes, unfortunately, also leading to death. We put together a research roadmap in February of this year, and this was recently updated as we brought back together in a virtual format over 1,200 scientists from around the world to discuss the big research priorities that are still remaining and to take stock of the knowledge that we had gained. So what I would hope that comes out of this consultation that you're having and the future work is to set up similar working groups or tracks which address the outstanding questions related to environment, related to pollution, and how that might impact the susceptibility or the severity of the disease on other meteorological factors which could potentially affect how this virus is traveling and spreading around the world, and other such issues. If those could be clearly articulated as research questions, then it would give a boost to research in this area. It would help research funders. It would also help those scientists who want to collaborate and work in an interdisciplinary or a multidisciplinary way in order to address some of the outstanding issues. The more we learn about the virus, the better our response can be, and the more tailored our response can be, and the more effective our responses can be. So I wish you all the best for your consultations over the next couple of days, but also I hope that this would lead to high quality research in this topic, which will then inform all of us. Thank you very much for this opportunity.
Thank you very much, Dr. Swaminathan, for this important speech, your visions, and also the roadmap and the research priority you presented to us. All four speakers point to the fact how important this e-symposium is. And once more, I would like to thank the four eminent welcome speakers and now hand over to the first keynote session on the understanding the dynamics. Can I please ask Dr. Olwocz to introduce the session? Thank you very much.
Thank you very much. It is my great pleasure to welcome you to the keynote session on this first day of the symposium. My name is Jane Olwocz. I'm the Executive Director for SASCO. SASCO is the Southern African Science Service Center for Climate Change and Adaptive Land Management. I'm here today in my capacity as the member of the Steering Committee of Future Earth's Regional Office for Southern Africa. For those of you who are hearing FEROSA for the first time, it is funded by the Department of Science and Innovation and hosted by the National Research Foundation, both in Pretoria, South Africa. Greetings to you all from Pretoria. Before I introduce my keynotes, please allow me to share with you two quotes that I came across yesterday when I was preparing for this symposium. Open quote. Surely, gravestones can speak about people who once walked the earth, of their joys and hopes and hardships, reminding us that they were no different than we who still live. Gravestones inscriptions also reveal the demography and epidemiology of area ages, the person, the place, and time of life and death. Close quote, Thomas Wolfe, 1900 to 1938. 100 years later, in 2018, David Morency and Geoffrey in their article stated that such gravestones will still speak emotionally about the deadliest event in human history, the 1918 to 1919 influenza pandemic. They concluded, open quote, a century after the world's deadliest pandemic, we are still energetically studying it, and we appear to stand at the threshold of discoveries that will one day save millions of lives, if, or rather when, another highly fatal influenza pandemic emerges. They concluded, we are here searching, but we are certainly not lost. Distinguished guests, ladies and gentlemen, we are here in 2020 under the COVID-19. We are still searching, we are not lost. With those few words, I'm therefore very honored to host today's session in which the keynotes will address the challenges of understanding potential environmental, meteorological, and climatic sensitivities of COVID-19. We have the honor of hearing from the two distinguished speakers, Dr. Aileen Marty and Dr. Rachel Lowe. Each keynote address will be followed by time for questions from the audience. Ladies and gentlemen, these questions will be moderated by my colleague, Dr. Behera of the German Agency for Marine Earth Science and Technology. I kindly ask you to type your questions into the Q&A interface that you see in your Zoom window. And Dr. Behera will make sure that as many themes as possible are addressed during the Q&A. Without wasting any more time, the first talk will be given by Dr. Aileen Bernstein. He is the co-director of the Center for Climate, Health, and the Global Environment at the Harvard T.H. Chan School of Public Health. And he's also a pediatrician at the Boston Children's Hospital in the United States. His work focuses on the health impacts of climate change on children's health and advancing the work solutions to address causes to improve health and well-being of the children around the world. But to facilitate a smooth virtual meeting, Dr. Bernstein's remarks have been pre-recorded, but he's online with us and will answer questions after his talk. Please project the presentation. Thank you.
Hi, my name is Ari Bernstein. I'm the Interim Director at the Center for Climate Health and the Global Environment at the Harvard T.H. Chan School of Public Health and a pediatrician at Boston Children's Hospital. And I'm delighted to give remarks at the opening of this meeting on the climatological, meteorological, and environmental factors in the COVID-19 pandemic. My remarks will address some of the lessons we might learn from the COVID-19 pandemic in the hopes that they might just help us prevent the next pandemic. I want to start by telling you a story of my job as a pediatrician. Earlier this year, well before we knew what we were in for, I was working at our hospital and at a time when we were suspecting cases of COVID to be coming in. We didn't really have adequate testing. And I remember one of the first children I cared for, we were suspicious as to having the disease, dressing up like an alien, putting on protective gear, glasses, goggles, putting on a mask, and walking into a negative pressure room to a child who, under the best of circumstances, would have been apprehensive about seeing someone whom they didn't know and not feeling well. But seeing someone who looked like an alien proved an additional challenge. And it took a bit of time to try and make any kind of rapport with this young girl. And eventually she got comfortable enough to let me examine her. And what I realized as I began to examine her was that it was quite possible that by touching this child, I was connecting myself with a bat halfway around the world. Because after all, it is most likely that the virus that was infecting this child had first moved from a bat into a person somewhere in China. And at that moment, it occurred to me that in order to deal with diseases like coronavirus, we need to think carefully about how we engage with nature. Because as I'll talk about in a minute, what we're seeing in terms of emerging infections, these diseases like coronavirus, and let's be clear, this virus has been enormously devastating. It's been devastating to our families, our communities, our lives and livelihoods. It's also exploited inequalities in our societies and made them worse. That diseases like this are really a sign that nature is giving us. Nature is trying to tell us something. And if we listen well enough, if we listen to what nature is trying to tell us, we will learn that we must protect nature if we are to protect ourselves. So let's dig into what I mean by that and start with thinking about what caused COVID. Well, at the very origin of it, as I alluded to, it involves spillover of a virus from a bat into a person. We know that we swim in a common germ pool with all other animals. That's the first lesson that this pandemic reminds us of. If you look at many of the diseases of people, whether it's rotavirus, which is a major cause of diarrheal disease and a leading cause of death in children under 5 in the world, bubonic plague, influenza, malaria, tuberculosis, all the diseases on this list, they all either have a first cousin in another animal or are directly transmissible from other animals into people, such as influenza. And so it's important to recognize that there isn't a discrete group of pathogens that simply affect people and another group of pathogens that just affect animals. These are the same pathogens. And so it is not surprising that we see emerging diseases moving from animals into people. Spillover happens when people come into contact with animals, and it turns out we're doing a lot more of that. We know that deforestation is a major driver of spillover. That isn't entirely surprising because biodiversity is concentrated in the tropics where there are tropical forests, and that rates of deforestation are going up, and that means people have to go into the forest, settle in the forest, chop down the forest, build roads in the forest. We know that deforestation, as one example, has played a role in the emergence of Ebola in West Africa and in many other infectious disease outbreaks. We also are appropriating wildlife in ever greater numbers through the wildlife trade. People are going into wilderness, harvesting animals, capturing them in some cases for pets, for medicinal purposes, some cases for food. And those contacts also risk spillover pathogens into people. Another force that is changing the way humans and animals interact is climate change. Climate change is forcing everything that can to get out of the heat. We see this enormous and extraordinary migration of every living creature towards the poles. Humans are also being forced to move, perhaps not to the poles as much as other species, but very much we're seeing human migrations at scales that are unprecedented since the end of World War II, moving from where they're living because of extreme weather events, droughts, floods, lack of access to food. And so spillover is likely to happen more as humans and animals come into contact in greater numbers and in new ways. As a consequence, it doesn't seem entirely surprising to learn that disease emergence is happening more often. That's what this figure shows. And that the biggest driver of that is the spillover of pathogens from wildlife into people. You'll notice that there's a bump there in the 80s that increases from organisms that are opportunistic infections during the peak rise in HIV infections. But aside from that, you'll see that the trend that is growing comes from zoonotic diseases of wildlife. There's also, of course, an important share from livestock species. We do see spillover from livestock, and in many cases, livestock are an intermediary between a pathogen in a wildlife reservoir going through a livestock animal and into a human being. Many people point a finger at the growing human population, urbanization, and global travel as major forces in pandemic risk. And that's absolutely true. The risk of pandemics is much greater with global travel, more people living in cities, and more people in general. But the way I like to think of it is that these forces are like jet fuel, which is spilling on the match of spillover. If there weren't spillover in the first place, the fact that people travel everywhere wouldn't be such a big problem for the risk of a pandemic. Now, obviously, it would help if we had greater surveillance of when a pathogen got into a population to control it. But I think it's important to recognize that addressing spillover is really the best form of prevention, because once a disease is spread into the four corners of the world, controlling it, as we know from coronavirus and other pandemics, can prove enormously challenging. I should mention, of course, that absent governance or lacking governance can be another force that is enormously difficult to deal with in the face of a pandemic, and I think coronavirus has shown that in spades. So if we're going to prevent the next pandemic, if we're going to listen to what nature is telling us, we need to do business with the biosphere differently. And that means protecting nature. And for those who've been paying even casual attention to what's going on in the biosphere, you'll know that the tumult of the moment is greater than at any point in 65 million years. The last time species were going extinct at the rate they are today was when an asteroid struck the Earth and wiped out about half of the species on the planet. That was 65 million years ago. Today, the major force in driving species to extinction is habitat loss. The biggest contributor to that is deforestation, which is done primarily for agricultural purposes. In the past several months, I've gotten to work with a team of scientists, including ecologists, economists, conservationists, infectious disease experts. And we're very interested in understanding what are the most effective mechanisms at preventing disease emergence, and also how much would those things cost. So we took a first pass analysis at understanding what it would take financially to do a suite of actions addressed at preventing pandemics. Those include curbing deforestation, tropical deforestation by half. They include better management of wildlife trade. They include better surveillance of spillover from wild animals to people. And we estimate that the cost of those activities are between $22 and $31 billion a year, which seems like a lot of money until, of course, you put that in perspective of the costs of this one pandemic, which we know now is costing around $10 trillion. So if we spent what it would take to really get at the root cause of pathogen spillover, which we estimate is $22 to $31 billion a year, and we spent that for 10 years, we would still only have spent on the order of a few percent of the costs of this one pandemic, which is to say our salvation comes cheap. I'll close by saying that I encourage us all to remember that we as a species tend to think downstream. We'd rather look at the forces that shape our lives that are nearest to us. And that has really served us well. But among the many things that we can learn from this pandemic, we can learn that we have to work harder to understand that forces that seem further away are just, if not more important. The trees in a distant rainforest might seem mostly irrelevant to us all unless we lived among them. But chopping them down could be the first step towards someone like me having to dress up like an alien again and hoping that the child in front of me stands a fighting chance at survival. So with that, I look forward to hearing your questions in the Q&A, and I'm wishing us all a productive and thought-provoking conference.
Thank you. Thank you very much for such a great talk and also sharing your personal experiences and daily experiences. Thank you also for just highlighting the importance of basic principles. Let us protect nature. So with those few words, may I now call upon Dr. Behera to read out questions that have been addressed. Thank you.
Actually, Jane, I think on account of time, what we're going to do is go directly to the second keynote, and then the questions for both will be taken after that.
Okay, thank you very much. So may I take this opportunity and welcome our second keynote. And it's a pleasure of mine to introduce Dr. Rachel Lowe, who is an associate professor at the London School of Hygiene and Tropical Medicine. Her research aims to understand how environmental and socioeconomic factors interact to determine the risk of disease transmission. She has worked extensively on the impacts that global change is having on vector-borne diseases such as dengue, Zika, chikungunya, and yellow fever. And she has been active in the research response to COVID-19 since early in the crisis. We'll hear her recorded remarks now, followed by time for questions. Welcome. Thank you.
Hello and welcome. Thank you for the opportunity to share with you some thoughts on the potential role of seasonality in the current COVID-19 pandemic and the motivation for considering climate in SARS-CoV-2 transmission dynamics. I'm Rachel Lowe, an Associate Professor in Planetary Health and Infectious Diseases at the London School of Hygiene and Tropical Medicine. When designing public health responses for COVID-19, it is useful to know if transmission will vary seasonally like other respiratory diseases that tend to peak in winter. This knowledge will help ascertain the potential benefits, if any, of incorporating Earth observations and meteorological forecasts in COVID-19 preparedness plans. Previous studies have shown that influenza viruses and other human coronaviruses are sensitive to environmental conditions, with higher temperatures and increased humidity reducing transmission potential, which means they tend to peak in winter in temperate regions. However, the underlying seasonal mechanisms are not entirely understood, And it's not clear if seasonality results from differences in virus survival outside the human host or seasonal differences in human social behaviours, such as spending more time indoors during winter. And because SARS-CoV-2 has emerged only recently as a human pathogen, there's still great uncertainty as to whether transmission will vary seasonally in different parts of the world. However, we do know that it's transmitted between people via direct and indirect contact with respiratory droplets, similar to other winter pathogens. So if there are similarities, and if SARS-CoV-2 establishes itself permanently in the human population, then it's likely that outbreaks will occur most frequently during the winter months. However, it won't be one single factor driving things, and there will be many interacting risk factors at play. We know that connectivity in the start of the pandemic was a very important driver for spreading the virus. And if weather and air quality conditions play a role, it will depend how they interact with other factors such as population density, the way people are living, also personal protection measures and other collective behaviours to reduce transmission. So at the start of this pandemic, there are many hypotheses that might be influencing COVID transmission. A very important one, of course, is the susceptibility of the population, which with the new pathogen has a very important role. Also the different varying government interventions that took place. And there was lots of speculation about the role of temperature and humidity. But as the pandemic has progressed, we've seen more and more evidence that COVID-19 has successfully been able to spread in very warm and humid climates. And so why do we need evidence? Well, it's very important when global leaders, including President Trump in February 2020, were stating that warm conditions would cause the disease to miraculously go away, and that by April, supposedly, it will have died away with hot weather. And these kind of statements can be very dangerous and lead to complacency. So there has been a whole series of preprints and some published studies looking into the role of seasonality on COVID-19, mainly correlative studies looking at cases of COVID across the world and comparing them to temperature and humidity data sets. And Rosa von Borries, MSc student at London School of Hygiene and Tropical Medicine, she has been conducting a systematic review on this topic. And as well as these country-level studies, there have also been 67 studies at the global level looking at this. But so far, we have not seen convincing evidence for a strong role of seasonality. And one of the main conditions is that, and one of the main reasons for this is that most studies neglected to include other important drivers such as lockdown measures, population density, the efficiency of contact tracing systems, age structure, and the like. So back in March, with Kath O'Reilly from the London School of Hygiene and Tropical Medicine, we wanted to compare the areas of the globe that have been classified as having local transmission of COVID-19 with the actual temperature and humidity conditions in those places. And we found towards the end of March that there were a large proportion of countries experiencing temperatures greater than 25 degrees C with relative humidity greater than 75% with local transmission. And we updated these results just 2 weeks later and found that practically the whole globe was experiencing transmission, showing that it was possible to be transmitted in all sorts of climate zones. And this kind of work fed into some early policy reports. Here's an example of a fact sheet issued by the Global Heat Health Information Network on the role of weather conditions influencing COVID transmission. And the conclusion is that there's insufficient evidence to suggest that seasonality will play a role. And it seems that that has played out over the summer months. In many parts of the world. And the consensus from the World Health Organization is that it can be sufficiently transmitted in hot and humid climates. Another myth buster from the World Health Organization is about the role of mosquitoes in COVID, and thankfully there's no evidence that mosquitoes can transmit COVID, but the pandemic has seriously hampered vector control efforts and access to care in endemic countries for other overlapping epidemics of dengue. So we have recently written an opinion that will be soon to be published in the British Medical Journal, looking at this endemic scenario in Latin America and how the different countries are coping with these overlapping epidemics of dengue, COVID, and other neglected diseases, and how this may impact vector control and also surveillance. We've also written a viewpoint with the Global Vector Hub at the London School of Hygiene and Tropical Medicine and other partners with a series of recommendations of how to maintain vector control during these difficult COVID times. And we can see this time series at the bottom here is showing us this is for a real but an anonymous city in Brazil. And we can see that reporting of dengue has completely dropped off in the last few weeks. And we don't know if this is related to capacity of testing, but there's certainly a lot of difficulties being able to accurately test for dengue during COVID-19. So now I'd like to present to you some of the early results from a collaborative study that we have started between the Centre for Mathematical Modelling of Infectious Diseases at the London School of Hygiene and Tropical Medicine and the multi-city, multi-country collaborative research network through which we're collaborating with partners in 27 countries to try and understand if and how there may be any weather signatures in the early transmission dynamics for COVID early in the pandemic. So we're looking at, we have data for cases and deaths for 502 cities across 27 countries in the world. And our goal is to try and model the effective reproduction number to understand if there are any influence or signals with temperature and relative humidity data. We want to do this over a window of time for which local transmission had been established, but before any government interventions had successfully been able to reduce contact patterns. And in this study, we plan to consider other ecological confounders such as the timing and intensity of interventions, human mobility patterns, and underlying socio-demographic vulnerabilities. And the challenge will be to see if we can identify any nonlinear or delayed effects of these weather signatures using distributed lag nonlinear models. So here we can see how the data is distributed across the globe in the different cities. We can see in red places that reported more than 5,000 cases. And in the whole database, we have more than 3 million cases. So we can compare the COVID cases to the mean temperature in these cities, again, seeing that the places worst hit are also places which have warm and humid climates. And on the right, we can see the overall distribution of our cities. We have majority of the cities are in the Northern Hemisphere and in temperate climate zones, but we do have data across 5 different zones. And we have a fairly good range of different population density. And we also have data related to the proportion of the population over 65 years, poverty rates, and other socioeconomic characteristics. So to try and understand how local weather variations may have or may not have played a role, we are using the ERA5 land database, which is available through the Copernicus Climate Data Store. And here on this map, we can see the mean temperature condition for the United Kingdom on the left and Brazil on the right. As you can see, it's not to scale. And this is showing us the temperature on the 15th of April across the 2 countries, and we can see the variation, and the stars show us where the MCC cities are located. And one of the issues we've seen with some of the studies that have been published claiming a role between temperature and humidity is that they're correlating country or region-wide averages of climate conditions with national reports of COVID cases. And if we see the little insert maps, we can see how different the mean temperature for the UK, for example, 8 degrees, is to the variation across the whole country, and also the same for Brazil. So to identify our time window where we're trying to establish a period of time for which there was unmitigated transmission, let's say, although that is impossible, we can use the data from the Oxford COVID-19 government response tracker. So that tells us how stringent the control measures were in each country at each time point. This here is just a summary showing us by region and also by individual country. So we can see that the stringency index peaked a lot earlier in the East Asia and Pacific region, mainly through China, and then also how it peaked later on for other European and Latin American countries, for example. And we're also considering subnational variation in interventions. This is just an example for the United States, which has had a somewhat discoordinated response across the country. So early on in the pandemic, there were national level measures to restrict international travel, for example, but decisions related to closing schools and stay-at-home orders very much happened at state level. And it will be interesting to be able to compare how these different stringency measures may have played out in influencing transmission. So to select our time window, we've been exploring different thresholds, considering a minimum number of cases per day for the start, and for the end, we're looking at different government intervention thresholds between 60, 70 and 80%, and having a maximum number of days of around 20. And we've been exploring how the growth rate and the standard error of the growth rate changes given those different choices. And it seems that our preferred measure is using a government stringency index of 70% and a maximum number of days of 20. And that gives us, that includes around 80% of the cities in our database. So we then want to have an estimate for the effective reproduction number. So RT is a measure of transmission at time t, and observations after time t must be adjusted. So what we really want to understand is the infection process, but any of the observed data we have, that reflects past transmission events. So we must account for that bias, especially if we want to understand the role and timing of any weather variation. So for this project, we plan to use the EpiNow2 package, which has been developed by Sam Abbott and Sebastian Funk and colleagues at the London School of Hygiene and Tropical Medicine, to estimate RT for our selected cities using these predefined windows of time. And the advantage of using this approach is that it reduces bias by estimating RT on unobserved infections rather than observed data, which is the approach taken by the Corrie et al. Method, which is in the EpiEstime package, which some of you may be familiar with. And the method that we're using is able to capture increases in transmission earlier on, and it accounts for several sources of uncertainty, including the incubation period, the generation time, and delays between onset and reporting. And you can find more about this in the Epi Forecast webpage that issues RT and several other measures globally on a regular basis. So we then want to explore the potential delayed and nonlinear effects of the exposures we're interested in, which are temperature and humidity. This here is just showing a visualization of how we have used this approach to try and understand variation in dengue fever. So this is a paper that we have under review at the moment, and this is just showing us using a delayed model combined with the Bayesian framework, we're understanding how the relationship between minimum temperatures and the relative risk of dengue changes given different minimum temperature thresholds. And we can see we find a peak between 2 and 3 months lags. On the right, we can see the overall cumulative relationship between temperatures and relative risk. This is for maximum temperature, and we can see this classic curvature where we have optimum temperatures around 34 degrees C. And it will be very interesting for looking at the COVID-19 dynamics to see if we see this hypothesized link between a decrease in relative risk at lower temperatures, and indeed if we may see any increase in risk at higher temperatures, which may be related to the use of air conditioning, for example, as may be happening in the very, very hot temperatures that are being experienced in the southern states at the moment and across parts of the Americas. So thank you very much for your attention. I will welcome any questions, and I'd like to thank all my collaborators and co-authors for helping me prepare this presentation.
Thank you very much, Dr. Rachel Lowe, for this inspiring and informative presentation. I would also like to thank you very much for highlighting the uncertainties that exist, and especially the kind of information that we need. You have also highlighted the importance of integration of data from climate and weather, socioeconomic factors, and also the importance of satellite Earth observation in giving us improvement to the data needs that we need. I'm sure we'll hear from you later. So thank you once again. And I would like now to move on to the next session, which is the Q&A that you have been waiting for. And for that, please allow me to introduce my colleague, Dr. Behera, who will lead this session. Over to you, Dr. Behera. Thank you.
Thank you, Dr. Oloch. So we have already several questions on the chat box. And I will start with one question from Professor Ben Zaitchik. And that question is for Dr. Bernstein. He is asking that you make a compelling case for funding conservation to protect human health, and the economic estimates certainly look convincing, yet it seems that few policymakers see this link, or perhaps they just can't act on it. What do you think the research community needs to do to establish association in specific and actionable ways?
Thanks for that question, Ben. I'd say a couple of things. I think the first is that it's important to bear in mind that politicians in democracies are most attuned to the needs of their own constituents. And so to the extent we can link work to the existing needs and interests of what people are likely to vote on, the better. And that can be a challenge for a number of reasons. One, if you get to increasingly small groups of people, it's hard to get data to necessarily matter to them. Academia, as a general rule, for those who are in academia, doesn't really reward people for doing that kind of thing. But nonetheless, I think politicians in democracies are really trying to pay attention to what's going to matter directly to their constituency. And so, I'll point a finger at our own work, which is we looked at global estimates, but focusing on a specific country is critical.
Thank you. We have another question from Hem Baidya, and she's asking about, would you recommend flexible supply chains and transportation networks in future for quick response to dynamic situations and potential hotspots? Also, is the dependency on few urban areas for global support, is it sustainable?
Yeah, it's another really important question. I've thought about supply chains, particularly in medical care, quite a bit. And what I'd say is that the supply chains tend to evolve based upon the perceived risks to the supply chain. It's a fairly organic evolutionary process. When there's a massive hurricane that knocks out a supply chain, people look and say, maybe we should bolster resilience in a particular aspect of it. And I think really to answer the question, I think it sort of speaks to how important prevention is, because right now there is no clear answer about whether we should sort of double down on building more robust and resilient hubs of global commerce versus creating a more diversified network. I mean, if you make a more diversified network, the supply chain is as strong as its weakest link. And so the advantage of having centralized supply chain is you can build protections better. Of course, not everyone can get the resource they need from that one place, but at least at a global scale, you can get major amounts of resources from one place to another. But then, of course, an individual hub fails. And so, again, we're conducting a real-time experiment here, and time will tell. But, with that amount of uncertainty about what the right course of action is, it makes the need for prevention so much more important. So I don't think there is a clear answer. It's a very good question. I know it's on many organizations' minds, and I just, this is as true in the context of global travel and infectious disease risk. Like, are we going to start having people travel internationally only to certain cities so it can do effective infectious screening, which has been floated as a reasonable idea? These are decisions that no one wants to make. No one wants to depopulate cities. No one wants to stop global travel. And so we need to bear in mind that adaptation to these things is limited by uncertainty, whereas many of the prevention actions not only carry long-term benefit in the case of pandemics, emerging diseases, but preventing deforestation could be justified on its carbon value, its water ecosystem service value, air pollution, because of course forests are mostly cleared, or many forests are cleared by fires. So there's a whole suite of benefits you could attain right now, in addition to long-term ones, which when you do adaptation, when you build more resilient hubs, when you try and bolster supply chains, that really has a much narrower benefit proposition, is also very expensive. And you might fortify the wrong part of the supply chain. And so it's a much more challenging enterprise in some ways.
There is one question about the use of respiratory support, and someone using iPad asked the pneumonia doesn't, particularly for pediatric pneumonia, we not necessarily need respiratory support, but for COVID-19, we need that for even children. So do you think it is insidious or is just underestimated?
Not sure. I'm looking for that question in the chat. I'm not sure I follow it directly. I'm not sure if the person who asked it might be able to ask it directly. Who asked it? Can you
using iPad?
Yeah, I can. Can you hear me?
Yes.
Okay. Yeah, the exact question, it was a little bit down the list. I didn't know to put it in the chat section. In the June 2020 issue of the Medical Journal Pediatrics, the authors Yuan Dong et al. Found that 46% of symptomatic children with lab-proven or clinically suspected COVID-19 had evidence of pneumonia, even though the vast majority of those cases did not require respiratory support. My question is, are the effects of COVID-19 on children insidious and thus underestimated?
Oh, okay, got it, thank you. So it appears that children, in comparison to adults, and the break point there seems to be puberty. So post-pubescent children behave pretty much like adults, and then there's an increased risk, particularly in people who are over 65. But there seems to be increasing risk with age. But younger children who get infected seem to do much better. They still, as the study you cited note, gets pneumonia. To me, the issue of insidious disease in children is actually not from direct infection. And I can't underscore this enough. I mean, yes, it's wonderful that children seem to be relatively spared. They're obviously not completely out of harm's way. The big problem for children is what it does to their families and their communities. We have, as everyone who's a parent on this session knows, huge problems with educating our children, the stresses of parents having to deal with job loss potentially, or trying to keep a job while figuring out how to care for their child. We have adverse childhood events. So people may have friends who get severely ill. And we know that adversity in childhood can be a source of strength. It can be a source of grit that allows children to actually be happier and lead happier lives as adults. but we also know it can lead to long-term health problems. So the real insidious disease for children with this pandemic is how it is affecting their emotional lives, how it is affecting their relationship with their parents, the stress in the household. We've seen already huge increases in rates of mental health symptoms, increasing rates of violence, these have lifelong health effects upon children who are caught. So I think that, to me, is the real issue here with COVID and children.
Thank you, Dr. Bernstein. For the sake of time, we'll move to questions for Dr. Lowe. The first question was asked by Dr. Neville Sweijd, and the question is, what is the process whereby a virus such as this one, COVID-19, can transition from a novel to an established or endemic virus? What is the process or conditions that need to prevail to allow this to occur, from a simple one to endemic one?
So at the moment, SARS-CoV-2 is a new pathogen for humans, but if it is to become established in the population, then it could well become endemic, like the other human coronaviruses and influenza. And once it becomes fully established, when it has reached enough people in the population, and we're yet to see how immunity will play out. Once it has established itself, then we may see it behaving more like other seasonal coronaviruses and influenza. But at the moment, the overwhelming factor driving this virus is the sheer number of susceptible people.
Thank you. There was another question on it was by our colleague Ben, and very interesting work to correct the difficult case count record. Could you comment on relative advantages of different approaches to response variable? For example, looking at COVID attributed deaths versus excess mortality versus hospitalization, etc.
Thank you. Yeah, that's a good question. So for the work I presented earlier, we're interested in looking at the effective reproduction number because we're just doing a cross-sectional ecological analysis at the moment. So we want to look at this sort of variations in transmission. And this particular measure allows us to think about correct for different reporting delays and biases. And it really depends which sort of aspect of the process you want to model. And it can be, often death data can be considered more reliable because it's very difficult to miss a death. But then if we're interested in the actual transmission process with weather, the time lags become very long. And there are many other different things you would have to consider. I've seen a few other questions in the chat related to, for example, indoor conditions as well, particularly once a case is hospitalized. So each kind of source of data has its own advantages and disadvantages. And if we want to be able to model the data correctly, then we would also ideally have some sort of data on sort of testing capabilities, sources of reporting to delay, and all those things, if possible, should be considered in our model frameworks.
Yeah, you raised the important point of the indoor conditions. So how do you going to integrate the indoor conditions with the outdoor conditions in your model?
Well, we haven't considered directly accounting for that in our model at the city level. I have seen some studies looking at individuals in hospitals where ambient temperatures were used, and I think depending on the response variable you're interested in, it will be very important to think about indoor conditions, and also things like we all know that one of the potential reasons climate is important is because the way we behave indoors. For example, in winter, we tend to crowd indoors, and we may be using sort of heating systems, which can be very drying, and the same in extremely hot conditions, air conditioning. can play a role. So I think it'll be very interesting if we can somehow account for those impacts of indoor environments.
There is one general question, I think, for both of you. Is there any role of pollution to enhance virus transmission from animals to human?
I think
the role of pollutions, like pollutants.
So there's been roughly a dozen studies, maybe some more now, that have asked the question, particularly about long-term air pollution and risk of dying from coronavirus. There have been maybe a handful of others that have looked at the risk of disease transmission itself. The studies that have looked at severity have mostly shown that there are increased mortality rates in places where people have been exposed to air pollution for longer. Almost all these studies are ecological in nature, so they use some aggregate measure of mortality as the basis, and that's probably the biggest cause for skepticism of their findings. But I think there's another important angle on this question that is often missed in the conversation about air pollution and death from COVID, which is that there's definitive evidence of a causal effect of air pollution on incidence of heart attacks, strokes, high blood pressure, and other diseases for which there's unequivocal evidence that having those diseases substantially increases one's risk of dying. And so I think there are really two questions here. One is, do we see a direct effect of long-term air, particularly long-term air pollution exposure on risk of dying? And the available evidence suggests that is possible. But the other question is, does air pollution affect risk of dying through intermediaries like heart disease, stroke? I think the answer to that is pretty clearly yes. And so, we see in the United States, just alarming disparities in who's dying, which may very well have to do with long-term effects of disparities in air pollution exposure, at least in part. And that signal is probably present in other parts of the world.
Thank you. You mentioned about the non-communicable diseases, but do we also see interactions among other infectious diseases like diarrhea, cholera, or other respiratory diseases with COVID? And how do we model that? That question is to Dr. Lowe. Yeah, first, what is for you? And is there any interaction among other
so air pollution and other diseases like diarrheal diseases, I think the links there are pretty weak based upon the literature, and the strongest literature is on air pollution and respiratory or mucosal surface diseases, so like ear infections in children. We see effects. The risks of air pollution do go beyond infections for sure, and even in children, the non-communicable diseases, and to the extent that those may influence infectious disease risk, it turns out that having diabetes, which is likely associated with air pollution exposure, is a major risk for contracting infectious diseases. And so it's really hard to disaggregate the effects of air pollution on many things. The easiest signals to see are often the most, dire, like mortality, but we also pick up on other potentially unexpected effects through pathways like diabetes being a risk for infections.
Thank you, Dr. Vincent. And Dr. Lowe, just a quick comment from you. Do you think it is easier to model all those complex interactions?
Sorry, was that question for me?
Yes. Do you think we should also introduce those factors in the model?
You mean comorbidities?
Yes, yes.
Yeah, I mean, I think it really depends on your research question and what you're trying to do, and in terms of how Earth observations or meteorological information might help. Then, particularly as we're moving into winter in temperate regions, we need to be prepared to think about that increased demand on the emergency services during winter and how it impacts not only how it will impact this coronavirus, but also other respiratory illnesses, asthma, other more incidents of broken bones, for example. So I think it'd be very important for us to track those meteorological conditions and think about how we can prepare our emergency services to deal with this sort of increase in demand in winter, and also the backlog of treatment, for example, in the UK that took place due to not being able to access medical services during the lockdown.
Thank you, both of you, for your nice answers to all the questions. And there are several other questions on the chat box, and if you have time, kindly look at them and directly answer to them if possible. Thank you. Back to you, Dr. Holwach.
Thank you very much, my colleague, Dr. Behera, for such an inspiring and thought-provoking question time. I'd like to thank the audience also for a very important questions that they asked that really highlight the interest and the passion that people have around this, this COVID-19. So we're almost coming to the end of this session, but before that, I would like all of you to join me as we thank our two distinguished guests that have shared their expertise and new research, but also reminded us of the old research that is really important for us to tackle this complex question. They have lighted a lot of things that are really important, but just highlight the uncertainties, particularly when we try to link COVID-19 and climate and weather, and just emphasize us to integrate different data sets from the socioeconomic particularly. I was also very excited to hear the exclusion of mosquitoes as vectors, but at the same time I asked myself, why should COVID go for mosquitoes when they have the perfect vector, who is the human being? I think right now we all know how much the human beings are actually going out of their way to spread this. But I am very excited, of course, for the call for nature protection, because this is a key thing in the future planning for this pandemic. So I thank you, the speakers, so much. And it has been an honor of mine to be part and parcel of this session. So our guest speakers, the participants, well done and thank you very much. And I would now like to hand over, and of course I thank my colleague Behera for leading the question time. May I now call upon Victoria to take us through the next session of this conference. Thank you very much, everyone.
Thank you, Jane. And we will go to the iPoster sessions in just 2 minutes. First, thank you to everyone for attending. For day 2 and day 3 of the conference, we need you to take an action item now, so you can be in a breakout room of your choice.
Victoria, I'm sorry, I'm going to interrupt because you're very quiet and I'm afraid the attendees can't hear this important information.
Hello to everyone. An action item for all of you that will help make this conference as effective as it can be for days 2 and 3. For days 2 and 3 of this conference, there will be breakout rooms. And you can see on this slide that Wednesday's breakout room will be by scientific topic and Thursday's by geographic region, where there will be small groups of scientists that will go into rooms and have discussions, moderated discussions by the topics of the conference or based on what is going on with the pandemic in a region of the globe. We're going to put a poll up now, and we would like everyone in this meeting to please make your choice. There'll be 2 questions. The first one will be to choose a scientific topic, and the second will be to choose your region of the country you'd like a breakout room for. We'd like you to choose these now, and the poll should be launching. And we will be able to break you into those rooms for day 2 and day 3. So if we could take just a minute to do this, and then I will pass to Aileen and we'll start our iPoster session. Right now, 100 attendees have taken the poll. Thank you. Please keep taking it. And remember, there are 2 questions to answer within the poll. If you're having any trouble seeing the poll or concerns, please put it in the chat. I see a question now, can you attend 2 sessions or only 1? We will be able to move you between sessions if that is a need. We would like you to choose 1 for purposes right now. And also, if you do not answer the question now, we won't know where to put you, so we will put you into a random breakout room tomorrow. And I want to hold this open for just a few more seconds. We've had almost 200 people take this, so that's great. And so the poll, once you submit it, it will disappear off your screen. And I'm going to put out just a last call. We have about 40 people who haven't taken the poll. And there are 2 questions. When the poll pops up, you should be able to scroll up and down between them. Question 1 is day 2. Question 2 deals with day 3. For people who do not see the poll, we will be able to reach out to you. I am going to close the poll down. And since we've collected most of the answers, and then we'll do some individual reach outs. Thank you for taking the minute out of the meeting for this. And I'd like to pass this over now to Aileen Marty, who is going to be talking us through the iPoster session and giving us a little information about some potential outcomes from this conference. Aileen.
Good morning, good afternoon, and good evening. It is a true honor to be here with all of you and to have already heard some outstanding presentations. I am here representing Elsevier Journal One Health. And so I want to, please put up my slides if you would, please, Victoria, so that everyone can see what I'm talking about. But basically, all contributors to this symposium are invited to submit manuscripts for consideration for peer review and inclusion in the special issue. The deadline for the submission, go ahead and click, is Monday, the 20th of September. The slide you're looking at was a previous version, so it says submissions close on the 6th of October. Please correct that to Monday, the 20th of September as the date. If you have any inquiries, you send email to onehealth@elsevier.com. And just pay attention that when you go to the site for submission, selecting your article type, be sure that you select environmental factors in COVID-19 and either research paper or review article, so that it's properly entered as part of the special issue. One Health journal is normally a journal that you pay to present your material, but not for this special issue. All the submissions are done free for this, for all contributors, as if you are a member of this symposium. Next slide. Okay, so now we're going to go into the iPoster viewing, and we will end the session of iPoster viewing at 11. You all selected from the poll into which of the various groups you're going to be going into. I just go ahead and click again. You're going to see when you go through the posters, you can enter search criteria, click, and Now I want all the hosts in the various symposiums to please turn on your chat and click. All the time here is based on Central European summer time. And if you need help converting that to your local time, go ahead and use www.thetimezoneconverter.com. And that concludes what I have to say to you. I look forward to seeing, we all look forward to seeing you at 11. Coming back to the main session. You're now welcome to enter the poster sessions of your choice.
And as Aileen mentioned, programming will begin again at 11 o'clock. Until then, please enjoy the iPosters, but there will be no live programming until 11 o'clock Eastern Time, 3 p.m. Greenwich.
The information that I just provided about the submissions will also be sent to all the participants in an email.